Hi, my name is Joni. Many of our clients ask, what ball should I be using to treat myself? Or what self-treatment tool is best to be using to achieve myofascial release? It's important first to remember that fascia, or the connective tissue in the body, responds best to gentle, sustained pressure. When we have gentle, sustained pressure, the connective tissue can start to soften, lengthen, and melt. Now when I say sustained, I'm talking about 3 to 5 minutes minimum of pressure in an area or in a restriction. Anything less than 3 minutes just gives us a quick stretch in the elastic component of the tissue, and it's not long enough for the collagenous or the thicker part of the tissue to soften and melt. Anything less than 3 minutes means that we get a quick stretch and it just springs back in tightness. So it may feel good for a little while, but generally the symptoms just come right back. So in addition to eliciting that sustained pressure into the restriction, it also needs to be a gentle pressure. Now why does it need to be gentle? Anything that is forceful, hard, or aggressive, the body, rightly so, perceives that as a threat and tightens and holds in protection. Whereas anything that feels soft or gentle or easy, it's like the body says, this is okay, this feels safe, I can soften, I can melt. And it's very easy to wait 3, 5, 10 minutes or however long it takes to get that nice deep release through the connective tissue. Whereas if it's hard or rigid or aggressive, it's really hard to wait that long, and we find ourselves wanting to just take the ball out or get off the tool. So as you can see, there's many options out there on the market as far as devices that we can use to treat ourselves. So I'd like to show a few of them to you and explain some of the key differences. So when it comes to treating ourselves and wanting that myofascial release, we need tools that are soft or have a bit of give to them. So for example, this yellow ball is inflatable and has squish or give to it. Likewise, this tool called the Cranial Cradle also has give. Now it's designed to be used anywhere along the spine from the head down to the tailbone to help release the tissues that get tight, stuck, or rigid along our spine. But again, it's easily accommodatable by our body. It feels soft, easy, and gentle. Whereas some of the other tools that are popular, like the spiky ball or a cricket ball, baseball, or tennis ball, these tools are very rigid, hard, and have very little to no give whenever we lie on top of them. Very similarly, tools like the Da Vinci tool, again, may be useful for other purposes, but for myofascial release, they're not appropriate and won't be as effective as the soft, gentle tools are. The other aspect of self-treatment tools that we want to look at is size and diameter. So as you notice, the yellow ball is about 4 inches in diameter. This means that it's easy to lie on top of it, whereas a ball like this, a bit larger in diameter, has the right amount of softness, but it's just a bit big, and our body tends to arch over it or be a little bit imbalanced in its position as we're trying to use it. Another self-treatment tool that's commonly used is the foam roll, and oftentimes you'll see people rolling their bodies up and down on it in an effort to get release or to relieve tension in the body. So again, because this tool is rigid and hard, what happens is you're actually grinding up the tissue or forcing the tissue apart, breaking up the cross links of tightness. So while that sounds good and sounds productive, what's happening on the cellular level is microtrauma, meaning the body has to heal it and does so by laying down extra thick or dense tissue to protect that area. Therefore, you feel like you need to foam roll again and again and again, and you actually find yourself in this cycle that behind the scenes is self-perpetuating. Whereas when we use softer tools that have a bit of give and wait that 3, 5, 10 minutes to get a release, the tissue has softened, let go, and is able to stay that way without injuring, without grinding, forcing, or breaking it up. So I hope you found this helpful, and certainly if you have any questions, please feel free to contact us. Or if you have a local therapist to you who's using myofascial release and has been trained under John Barnes, they too would be able to give you specific advice about your situation, symptoms, or what you're experiencing as you're treating yourself. Thank you.